Have you ever felt that desperate sensation of trying to fill your chest with air and it seems like the oxygen doesn't enter? Or that disproportionate tiredness just climbing a flight of stairs or walking to the gate? Frequent shortness of breath, which doctors call dyspnea, is one of the symptoms that generate the most anxiety in people over 50 because it directly attacks our most basic survival need. We often ignore this sign, thinking it's just the burden of age, lack of fitness, or the heat. But the truth is that difficult breathing is rarely normal and almost always indicates that a vital gear in your body is failing. In this video, I am going to reveal the 3 most common diseases that hide behind this constant shortness of breath and that need to be diagnosed as soon as possible. One of them is well known. The other is a big surprise because it has nothing to do with the lungs. And the third is silent and may be robbing your energy right now. Stay with me until the end, because understanding the origin of this tiredness can be the decisive step for you to regain your breath and quality of life. Let's start by understanding what your body is really trying to tell you with this symptom. Differentiating tiredness from shortness of breath. It is fundamental to know how to differentiate common muscle fatigue from pathological dyspnea. Normal tiredness happens after intense exertion and quickly improves with rest. The worrying shortness of breath is that air hunger that appears during activities you previously did easily, like showering, making the bed, or speaking a long sentence without pauses. If you notice that you are changing your routine to avoid exertion because you know you will run out of breath, this is a clear sign that the capacity of your cardiorespiratory system is compromised and is not able to meet your body's oxygen demand. This symptom should not be normalized as part of aging. Aging healthily means maintaining functionality, not living out of breath. Shortness of breath is a warning that oxygen transport or gas exchange is defective. Before we get into the first disease, pay attention if this shortness of breath is accompanied by wheezing or a cough, as that is a valuable clue. Let's now unveil the first major cause, which affects millions of Brazilians, and many don't even know they have it. If you want to stop having doubts about what your body is feeling and start getting clear answers, take this moment to click the like button and subscribe to the channel. By doing this, you guarantee that you will receive our next health guides firsthand, and you help me continue producing this vital content for you. Disease 1. The obstructed lung, COPD. The first and most frequent cause of chronic shortness of breath in people over 50, especially in those who smoked or lived with smokers, is chronic obstructive pulmonary disease, the famous COPD. It includes chronic bronchitis and pulmonary emphysema. In COPD, the passages through which air travels become inflamed and narrowed, and the air sacs, alveoli, lose elasticity. The result is that air enters but has difficulty leaving the lung constantly full of stale air, preventing the entry of new, oxygen-rich air. The danger of COPD is that it is progressive and irreversible, but totally treatable to stop its progression. Many people think that a phlegmy cough in the morning is normal for smokers, but it is already the first sign of the disease. If you feel short of breath mainly when doing physical exertion and have a history of smoking or exposure to wood stoves and dust, your lungs may be calling for help. But attention, the problem is not always in the lungs. The second disease is the one that confuses patients the most and can be fatal if left untreated. The signs of COPD beyond shortness of breath. Besides difficulty breathing, COPD usually gives other signs that you can observe at home. Wheezing in the chest, that meowing kitten sound when breathing, is very common, as is the excessive production of phlegm, which can be white or yellowish. Another point of attention is the frequency of respiratory infections. If you constantly have colds that go down to the chest and take a long time to cure, this suggests a pulmonary fragility characteristic of the disease. Identifying COPD early is crucial because, without treatment, the lack of oxygen begins to overload the heart and other organs. The use of inhalers and pulmonary rehabilitation can restore much of your breathing capacity. However, what happens when you get a chest X-ray and it is clear, but the shortness of breath continues or worsens when you lie down? This is where our second disease, which is a wolf in sheep's clothing, comes in. Disease 2. The disguised heart. Heart failure, the second most common cause, and one that deceives many people, is heart failure. The patient arrives at the doctor's office swearing they have a lung problem, but in reality, The problem is that the heart is weak and cannot pump blood correctly. Because the heart does not pump effectively, blood pools in the lungs, causing fluid leakage. This fluid occupies the space that should be taken by air, generating a terrible sensation of drowning and shortness of breath, even though the lungs, structurally, are healthy. This is very common in those who have had high blood pressure for many years or have already suffered a heart attack. The tired heart generates this pulmonary congestion. It is vital to differentiate this, as treatment for the lung does not solve the heart problem. If you treat a bronchitis that is actually the heart failing, you lose precious time and put your life at risk. There are specific clues that differentiate heart shortness of breath from lung shortness of breath, and I will tell you now how to identify them. This alert about the heart is one of the most important I have ever given here. If you think this information could save the life of someone you know, subscribe to the channel now and leave your like. Your subscription strengthens our community and shows YouTube that serious health content needs to be a priority. The pillow sign. Orthopnea, a golden tip to know if your shortness of breath comes from the heart, is to observe how you sleep. People with heart failure frequently feel shortness of breath worsen drastically when they lie flat in bed. This happens because, in a horizontal position, fluid spreads more easily through the lungs. For this reason, many patients need to use 2 or 3 pillows to sleep almost sitting up, a condition called orthopnea. If you need to raise the head of your bed to be able to breathe at night, your heart needs to be evaluated urgently. Furthermore, heart-related shortness of breath is often accompanied by swelling in the legs and ankles at the end of the day, sudden weight gain due to fluid retention, and a frequent need to urinate at night. If you combine shortness of breath with swollen legs, the chance of it being the heart is very high. But we still have the third disease, which is neither in the lungs nor the heart, but runs in your veins and silently steals your breath. Disease 3. The oxygen thief. Anemia. The third disease behind frequent shortness of breath is anemia. Think with me. The function of the lung is to put oxygen into the blood, and the function of the heart is to pump that blood. But the red blood cells, hemoglobin, transport the oxygen. If you have anemia, you have few transporters. The lung works, the heart works, but the oxygen does not reach the muscles and brain because there is no truck to carry the load. This generates compensatory shortness of breath. You breathe faster, trying to compensate for the lack of transport. In the elderly, anemia can be subtle and caused by a lack of iron, vitamin B12, or even small unnoticed bleedings in the intestine. The person feels extreme tiredness, palpitations, and shortness of breath even with small efforts, and is often pale, with the inner part of the eyelid discolored. It is an invisible cause in imaging exams, appearing only in blood tests, but it completely knocks down your disposition and breath. Immediate emergency signs. Regardless of whether it is the lungs, heart, or anemia, there are moments when shortness of breath stops being a chronic symptom and becomes a medical emergency. If shortness of breath comes on suddenly, accompanied by chest pain, cold sweat, dizziness, or if the lips and fingertips turn bluish, cyanosis, do not wait another minute. Seek an emergency room. This may indicate a heart attack, a pulmonary embolism, or an acute respiratory failure crisis. Another maximum alert sign is air hunger at absolute rest. If you are sitting on the couch, doing nothing, and feel like you cannot breathe, your body is at its limit. Do not try home remedies or teas at these times. Lack of oxygenation can cause brain damage and cardiac arrest quickly. Knowing how to respect the body's limits and seek help at the right time is the greatest act of love you can have for yourself. Are you enjoying the clarity of these explanations? Then, please click the subscribe button and turn on the notification bell. I want to have you close by in the next videos so we can continue taking care of your health together. Leave your thumbs up to support the channel's growth. How to discover the cause. Diagnosis. To find out which of these 3 diseases is causing your shortness of breath, the doctor will need to put your report together with some fundamental tests. The complete blood count will rule out or confirm anemia. A chest X-ray and, especially, spirometry, the breath test, will evaluate the health of your lungs and check for COPD. As for the heart, the echocardiogram is the gold standard exam, as it views the pumping strength of the heart muscle. Do not try to self-diagnose or use the neighbor's inhaler. The treatment for anemia is iron or vitamin replacement. For COPD, it is with bronchodilators, and for heart failure, It involves diuretics and blood pressure medications. Using the wrong medicine not only does not solve the problem, but can worsen the condition. A precise diagnosis is the bridge between living out of breath and regaining the capacity to enjoy life with your grandchildren and family. Frequent shortness of breath is never just old age. It is a real symptom that the body is fighting to get oxygen. Whether due to an obstruction in the lung, COPD, a weakness in the heart failure, or a lack of cells in the blood, anemia, all these conditions have control and treatment. Regaining your breath is regaining the freedom to come and go. Do not get used to living with less air than you need. Consult a general practitioner, cardiologist, or pulmonologist this week if you identified with the symptoms. I hope this video has shed light on what may be happening to you. Take care of your lungs, your heart, and your nutrition. If this content was useful, share it in the family group, as many people suffer in silence thinking there is no solution. Thank you very much for your company, and until the next video, with much more health for you. If you made it this far, it's because you truly care about your health. Subscribe to the channel now so you don't miss the next video, and leave your like if you are going to schedule a consultation to check out this shortness of breath. A big hug and breathe deeply.